Okay, so everybody, we want everybody to just slow down here. Okay, everybody slow down, just kind of relax, sit back, and what we're gonna do is we are gonna talk with Annie about her Substack. Now, as I mentioned, just leading into this, Annie's a medical advisor for NeuroReserve, but the bigger thing for her is she's the founder of Brain Health Kitchen, and Annie started that about like 10 years, going on 10 years ago, and it's how Annie began learning about all the different evidence, especially dietary evidence, with respect to Alzheimer's prevention and reduced risk reduction, and started translating it all into just awesome, wonderful recipes, just innovative, practical, but just delicious recipes. And so I just wanted to speak with you about a couple things. The first is, there might be people who are watching or who will watch who haven't met you before. So if you can briefly introduce yourself and how you became interested in Alzheimer's prevention, and then and mention a little bit how that led up to Brain Health Kitchen and then the book. But then in particular, would love to speak with you about your Substack newsletter, because that newsletter just celebrated a year, I think, of being out there. So you have a lot of great experiences there as you've been getting that going, and would love to hear more about that. But I will just let you introduce yourself.
Oh, thanks. You are so nice to have me on to talk about my Substack. It's like my child. It's like one of my dogs or my children right now. It's something very near and dear to me, because it's not really just a newsletter, it's a community. But for those of you who haven't met me, I am a medical doctor, and I practiced obstetrics and gynecology for 20 years. I live in Jackson, Wyoming, where we have a lot of snow. And, I'm a medical doctor, so I delivered babies, I did surgeries, I took care of women, I did primary care for women. The last 8 years of my practice, I focused exclusively on menopausal medicine. And that's probably when I first started getting interested in brain health, because a lot of my patients were coming in complaining of memory problems, cognitive problems, very common things in menopause that don't mean you have Alzheimer's. But I'm starting to think about, wow, like cognitive problems are really common in a young age group. And so fast forward a couple years, and I was just really itching to do something different. I'm a mom, and my kids were in middle school, and I had been working really hard ever since they were babies. Always had a full-time nanny, because I was always being called away to the hospital for emergencies. And so by the time they were in middle school, I just didn't want to miss any more soccer games. And so I decided to retire, and I wanted to be home. And I was just having this pull home. I also wanted to use like a more creative side of my brain. Medicine is an absolutely wonderful field, and I enjoyed it. I loved my patients. I loved doing it. It's an incredible calling, but it's also a very difficult lifestyle. It's hard on your family. You don't get enough sleep. It's really hard to be healthy when you're a busy physician. And I was feeling that, 20 years in, I was just really feeling it. And I'd always wanted to go to culinary in school. So after I retired, when my kids went to summer camp, I started going to get culinary training. I ended up going to a couple different places, one in Mexico, one in Italy. I trained at the CIA, the Culinary Institute of America in San Antonio, Texas. And I came back to my community. I just started teaching people healthy cooking, because I really felt, even as a physician, that one of the root causes of a lot of the problems that I saw in my practice, surgeries, complications of pregnancy, what have you, was that people just weren't really eating whole foods. They weren't eating the right foods. They were relying too much on a junk food diet. And I just maybe naively thought, if people just knew how to cook better and I can make it delicious for them and use my culinary training to do that, then people would just be healthier in my community. So that's what I started doing. And then I kind of came around to focusing on brain health for a couple of reasons. Number one, I started partnering with my local hospital for a dementia prevention program. This was somewhere in 2013. And, this was the first dementia prevention program that was in a community-based hospital in the country. And I did the culinary program. I partnered with a cognitive health specialist. And we had this great group of, healthy elder people in our community coming. And we did a 6-week program and taught them everything that we knew back in 2013 about dementia prevention, which was a lot. So I started getting really interested in the science behind what you eat and how it slows down the aging of your brain. And then when my mom got diagnosed with Alzheimer's, this was 2015, I took an even deeper dive. I made it my business to know absolutely everything about the field in terms of how do you slow it down. If you have early Alzheimer's, she had mild cognitive impairment at that time, which did progress to Alzheimer's, but I was very interested in slowing the process, keeping her home for as long as possible, and reading all the research about that. And there was so much then. That's when the Mind Diet study came out, which, Relevate is based on, that and other studies, that I was compelled to start Brain Health Kitchen as, my primary focus in just helping people eat better to prevent age-related cognitive decline, to slow down any kind of cognitive impairment they may already have, and hopefully just prevent it outright. And here we are, 10, 12 years later.
Yeah. So you didn't really retire. Right? I like how you call it. I retired.
I retired for a nanosecond.
You actually went.
There was like 2 months in the winter where I was a ski bum, and that was really, I have very fond memories of that.
Well, I mean, thanks for just getting people like familiar with how you got into this field, and earlier this year, and a lot of the this work that you've been doing culminated into kind of like a book, the Brain Health Kitchen, Alzheimer's for Food, and right there, yeah, and that was released.
January.
It was released in March.
January
Is that right?
This year.
January, yeah, it was January, and that there. I mean, Can you tell us a little bit about what you wanted to accomplish?
So I started thinking about the book when I started actually teaching cooking classes, more robustly. I was traveling to different cooking schools and traveling to wellness destinations. I was teaching in church basements and schools and medical schools and, women's groups and men's groups and talking about Alzheimer's prevention. This was around 2015. And I started thinking about it because my students were like, well, you should have all your recipes in a book. Because what I was doing, I was creating recipes from the Brain Healthy Food group and then showing people how to cook them and make it easy and delicious and all that stuff. So, the very beginnings of the book go back that far. I started writing down the book proposal probably like 3 years later. And what I wanted to do with this book was, I first started thinking I was writing a book based on the Mind Diet, but the Mind Diet came out in 2015. My book came out this year. And in the interim, as you know, Ed, there's been so much data about brain health nutrition. So we just know so much more. The Mind Diet is a very important cornerstone piece of research. It was, one of the first very well done studies to show that what you eat prevents Alzheimer's. But there's other studies as well. So it's really a reflection of all of the data to date. And so, but it's based on the brain healthy food groups that was described in the Mind Diet study. So each chapter is a different brain healthy food group. Like there's a food group for berries, a chapter for berries. There's a chapter for leafy greens. There's one for fish and seafood. There's a whole chapter on olives and olive oil and nuts and seeds. And I changed the food groups a little bit to reflect the modern science we were seeing. For example, there's no chapter on drinking red wine, which was in the original Mind Diet study. But there's a chapter on drinks. And in that chapter, I talked a lot about coffee and tea and water and which drinks are good for you and which drinks you really need to avoid. And I put it all into a pyramid. So I came up with this brain food pyramid. And this is not meant to be prescriptive. Like I'm not telling people like this is what you should, exactly how you should eat. It's meant to give you a template for you to build your own food pyramid based on what you like to eat. For example, if you're vegetarian, you don't eat any fish and seafood, which is that blue line, then you just take that one out. And we can make a strong argument, Ed and I, for supplementing omega-3 fatty acids if you do that. But this is basically for everyone. It's for people who, maybe you eat meat, maybe you don't, maybe you don't eat any nuts. So I added seeds as a brain healthy food group to fill that in. But it's meant for you to like pick and choose your own adventure, build your own brain health pyramid, and make it sustainable. because it's not a diet. It's not something you go on in January and go off in February. It's actually like a way of eating that fits very much with the foods that you love and the way you like to cook, and your budget and your background and all of those things.
That's right. That's right. You know, and that's one thing I think one of your favorite words is dietary pattern, not necessarily diet. Here's a diet. It's not necessarily, it's not that. It's better described as a dietary pattern. And that is not just, it's the way of eating in totality, when, how, with who, you know, but also not necessarily sticking prescriptively, like you're saying, to a very specific, here are these, only these food groups, you know, and you can only select out of those.
And it's not about eliminating food groups. I think that's the worst thing people can do, is eliminating, you know, unless, you know, you're eliminating animal products, that's, you know, that's certainly reasonable, but to eliminate grains or eliminate beans or eliminate things like that we know are really neuroprotective is really not a great idea, because we know that diversity of food choices is very important for brain health.
Super important, you know. So if anybody walks out of this conversation, you know, as you're relaxing, you know, I know it's the holidays right now, you know, and so stress levels actually in the holidays go way up, you know, actually for most people. So you're relaxing here, just remember, just keep in mind that what we eat does have a profound effect on the likelihood of age-related brain diseases in the future. And that is good news. That isn't meant for pressure. That's really good news. It means we have a way that's pretty easy and can be quite delicious to protect ourselves from you know, ailments like Alzheimer's and other dementias. And I'm glad you brought up that your mother has Alzheimer's diagnosed, because what I think that it really brings a warmth and a heartfeltness to everything that you write, really, and also a seriousness as well, because of direct family that's been involved for you. That it's one of those things that's very, very hard to just pack all together, you know. And so, so was that a cat?
That was Libby. She's talkative. She wants to go outside. Can you excuse me for 1 second?
Yeah.
Sorry. You know, it's true. Like, so I feel like I'm on this journey with all of the people who, you know, choose to cook from my book, and the people that come to my newsletter. I think of it as a community. And a lot of us do have parents with neurodegenerative diseases like Alzheimer's or Parkinson's, FTD, vascular dementia. You know, it's not just really about Alzheimer's, but I feel like we're all trying to be incredibly proactive. And thank you for saying that it's very heartfelt, because it is something that is super important to me, is to convey, you know, that we have more power than we think. You know, when you have this family history and you see a loved one suffer, and you see what that's like, and then you just think that that's going to happen to you. You know, it's just a natural inclination for people to think that their genetics determine everything, when of course we know that that's not the case, that there's so many things you can do. So I do love writing about that, and I'm on the same learning journey as everyone who comes to read or cook from the book.
Yeah, so that's a good you know, way to actually move into the Substack. And I know some people might not know what Substack means. It sounds like very technical, Substack or something like that. But why don't can you describe what that is, and also just you know, where you know, how you got that going, and
sure. So the Substack is a platform for writers. There are a lot of writers over there who are, you know, writing newsletters or popping in every once in a while to just share their thoughts. It's kind of for people who got a little bit tired maybe of social media and want to curate a community of readers who are interested in the same topic. And so I find that my Substack community, the Brain Health Kitchen community, are people that really want to be there, you know, because you sign up to have a you have an account on Substack. You can follow different writers. For my newsletter, there's a free version and a paid version. So I have tons and tons of free subscribers that come in and read the content, and I have separate content for them as I do for paid. So there's different tiers. It doesn't necessarily cost anything. So I feel like people are coming there because they really want the information, and that creates a vibrant, interactive community. Like the comments I get over on Substack are a lot different than the ones I get over here on Instagram, for example. Because people are diligently coming over there. They're like seeking out the information. So I feel like we're all sort of aligned on this common cause and this common thirst for knowledge about what are the best practices for brain healthy living. Nutrition, of course, is a big part of that, but I also talk about exercise. I talk about medical factors. I bring in my medical, background to talk about reducing cholesterol, importance of blood pressure, preventing diabetes, treating your blood sugar, things like that, most doctors are very well versed in, but it's very, very pertinent to the Alzheimer's prevention conversation.
Yeah, I totally agree that Substack, newsletters, and that kind of community that gets built around them, it slows things down a little bit. Outside of social media, it's a place where people kind of slow down a little bit. So hopefully people are slowing down here a little bit, but slow down, and then really, when I look at the photos that you drop in there, to start out, some beautiful, scenery, from probably, Wyoming usually, wherever we might be, because you're instructing in different parts of the world, and but just kind of nice photo, and then you just kind of move into, here's a topic that we're going to cover, and we're going to cover it a little bit deeper, and you do really bring that MD approach. It's timely. It's like some of the latest evidence that's come out, and it's it's accurate, right? And so that's really it's
really a great place to talk about the studies that come out. Like don't get me wrong, having a book is amazing. It's always was my dream to write a book, especially a cookbook. So it's amazing to have a book, and there's 400 pages of a third of this is science, and the rest is all recipes. It's really more of a cookbook, but there's a ton of science in it. But when the cookbook went to print, I had to cut something like 100 pages of scientific information. And so I decided to launch the Substack newsletter right when the book came out, because I felt like this needed to be a continuing conversation about brain health. It's not like I wrote the book and then I was done. Here, just go make these recipes and you guys will be just fine. Because there's all this information coming about, like ApoE4 carriers, or the importance of cholesterol and reducing, your risk of Alzheimer's. There's new information about FTD, about how the mind diet prevents Parkinson's. A lot of this stuff wasn't, even when the book went to print last summer, it wasn't available. So what I'm doing is I'm writing 2 letters a week. One is brief, one is more in depth. And we usually, download a study that came out. I like to get to people before they see the sensationalistic headlines, because so much of the science that, is portrayed on social media or in all media has these clickbait headlines. And I'll read the headline and you'll read the headline, and then we'll go and read the paper, and we'll be like, that's not what the paper says. That's like completely misleading.
Or drug may cure Alzheimer's, and then you look at the actual scientific paper and it was done in mice, and it was like, oh.
Or animal data, which you have to be we've gotten a lot really burned with animal data in the Alzheimer's world, so we're very skeptical about animal data. So I read an animal study, I'll be like, well, that's interesting. There's some human studies, I'll write about it. So I like to get to people so that they are the most up to date in their knowledge, because a lot of the science that's coming out is actionable. Like, I'm most interested in the studies that you can take a kernel of knowledge home and change something, either with your diet or the way you exercise. We did a mini series on exercise and strength training earlier this year, and a lot of the community has been getting into doing more weight training, even just like resistance bands, mild weight training, huge brain health benefit, really good studies on that, and also being careful about protein intake. So, there's actionable things we can take from the research, and I think that's really exciting. And to be having an ongoing conversation with a group of people about this going forward is, it's basically why I get up every day. The first thing I do is I work on my newsletter.
Yeah, and so for people who who want to keep up with the latest in science, and also take a hard look at what's already out there and find new ways in order to apply it, and then you should really consider this Substack or this newsletter. I mean, it's not just that as well. There are there are cooking demonstrations that go along with it. There are Q&As, right? Right. You should probably be saying this, Annie, so I might describe it wrong, but.
No,
yeah.
you're doing great. Yeah, and I'm still creating recipes. So I really enjoy getting in the kitchen and creating new things and thinking about neuroprotective foods in a different way and trying to find ways for you to use them in your kitchen that's easy, accessible. We're kind of into recipe templates right now. I'll take a recipe from the book that's been really popular. Like recently we did a butternut squash and coconut curry, and then I made a recipe template out of it so you can riff on it with whatever you have on hand. You could add chicken, you could add seafood, you could add tofu, you can add different vegetables, you can cut out the coconut milk and use almond milk to cut down on the saturated fat. Just all the ways that you can, mix things up in your own kitchen, which is what cooks do. So that's really fun, and we're getting into more in-depth topics in mini-series, like the exercise, like the cholesterol, like the osteoporosis. And the newsletter just really allows me to go into a certain amount of depth. But the very top of every newsletter now, I'm listing the takeaways, because I know people don't have a ton of time to read every word, although a lot of people do read every single word. But I know that like when you have a science-based newsletter, skimming for like, what is the takeaway? What is it that Annie wants me to take home and think about?
Yeah.
I am listing a list of those at the top. But everyone's welcome. I have a lot of free subscribers. I have paid subscribers, and I also have a founding member group, which is a different tier, and they get 4 cooking classes a year, which I call them kitchen chats. They're live. They're from a kitchen. We meet on Zoom and we talk about something. We were just recently did one this week, and we talked about the Mind Diet study, the second one that came out. And then we made a couple of different wintry pestos and a dessert, and it's just really nice to see people's faces and answer their questions one-on-one. Yeah,
so this is so there's so much that goes along with it, and I just so there, if people want to just get started, like about getting going with their brain health, there is that, like, there's a free kind of tier, right? And if people
everyone is welcome. Doesn't cost anything at all.
Yeah. So there's that, and then there's if you want to go deeper and start to get read like full articles on things, then there's another level, and then of course there's a people who are really serious, right? You really want to go for it, right? You want to get you want to be able to learn as much as you can. Then there's that, what you call, like, what was it called again?
The founding members.
The founding level. So there are different ways to get involved in the Substack, in Annie's Substack, and just kind of keep up with everything that's going on in brain health. And just wanted to really make sure we highlight that so that people can understand. Where can they find your Substack?
So you go to brainhealthkitchen.substack.com. It's SUBSTACK, Substack. And what I'm doing this month is I'm having a buy one, give one special. So if you purchase a subscription, an annual subscription, or you upgrade from a free to a paid subscription or a founding member, then I'm going to give you one to give away. And I'll send you a gift certificate in the email, and you can share that with someone, and they get an entire annual subscription for free. And I'm also rolling out a scholarship program. Like I get a lot of emails from people that they want to join, they want to read everything, but it's not in the budget, and I totally understand that. And so I'm giving away 25 subscriptions, annual subscriptions, in this scholarship program. And so in addition to matching everyone who joins between now and the end of December 2023, I'm also giving away an additional 25. We're starting to rack up a lot of scholarships, which makes me really excited.
That's great. Yeah. So you're going to blow this thing up this year, Annie.
Well, I'm really happy to spread the information. I get tons of feedback from community members about what they want to read, what kind of recipes they want. how much detail they want to go into. And so I feel like the people that interact with me on the newsletter in the community are really shaping the content as we go.
Yeah.
And that's really fun. That's really great.
Yeah, I liked reading through like all the comments people made. I think you sent out an email earlier saying, everybody tell me your comments about how this year has gone, what you've learned, and then a bunch of people wrote back, and then you actually summarized it all in the next message that went out. And I could hear how people are, how they've been, going really deep on things, how their cooking has improved, and et cetera. So it's great. And
that was so useful for me. Because we just hit the 1 year anniversary, and I just wanted to know what people like. What's your takeaway? What's the biggest thing you've gotten out of the newsletter? I've had people who were formerly vegan tell me that they're starting to introduce fish and seafood a little bit more because they learned about omega-3 fatty acids.
Yeah.
And then I had other people say that they've gotten more ideas to be more plant-based. And that's really exciting too, because that's really the backbone of the brain healthy diet. All the brain protective diets is being mostly plant-based. So it's I really feel good about that. That people are finding. It's my intention is that people find their own way to access brain healthy nutrition, and make it work for them and make it fun too. Like Alzheimer's is a heavy topic. Neurodegenerative diseases are a heavy topic. A lot of us are dealing with this with our family members in our daily life. And my intention is to make it, fun and enjoyable to be part of a proactive community moving forward. And we actually have a lot of fun, I have to say, for such a heavy topic.
Yeah, exactly. Like really positive, very positive. And you're right, it's a very heavy topic. I mean, in my own family history, and plenty of experience there. So just, thank you very much, Annie. And oh yeah, that's correct. So one more thing, is that there is another way to get involved in the Substack. So, Near Reserve, we have a special offer this month for a book. So Annie's book and 3 months of her Substack to get started. And so that goes with three months of our product Relevate as well, which is also built around.
That's a great way to get started.
So there's a bundle there, and then there's also, if somebody just begins subscribing to Relevate, they'll also get up to 3 months of Substack as well. So there's a couple different ways. Annie mentioned buy one and then gift one, right? And then there's scholarships, and then there's ways to get involved through Near Reserve by taking up and ordering some of the special offers and getting started that way. So there's lots of different ways to do it. And as she was just saying, everyone, this is really positive. It's a very positive community, proactive, and just wants to make this journey effective and fun and communal.
Yeah, we're all in it together. We really are all in it together, and we're learning more every day. And as us being the scientists in the room, we just really want to shorten that time period from when the studies come out that are useful to people until it gets disseminated out there. They say the average scientific study takes 17 years until the average person, folds that into their lifestyle.
Yeah.
We don't have 17 years when it comes to this topic. We want to act right as soon as we know what the information is. We want to act right away. Absolutely.
So, well, thank you so much, Annie, for coming on and spending some time here and telling everyone about what's been going on with you and the Substack, and just really appreciate what you're doing. And
thank you. Well, thanks for having me. Thanks for having me. Let me talk about one of my favorite children, my Substack. And if you join, just send me a message and let me know how you found me. If you found me through Neuro Reserve or some other place, it's just nice to get to know you a little bit.
And have a wonderful day, wonderful weekend, wonderful holidays. So. We'll be in touch about various things. Love exchanging emails with you. So we'll be doing that. And everyone out there, wonderful holidays. Enjoy the weekend, and thanks so much for joining.
All right. Thanks for having me. Thanks everyone for joining.
All right. Bye, Annie. Bye, everyone.
Bye-bye.